Hi there, everybody. This is Carrie Hamblen, the CEO and president of the Las Cruces Green Chamber of Commerce, coming to you again with another one of our member Zoom chats. And we are uplifting and highlighting all the amazing programs that Aprendamos provides in this community. And they've got so many programs. And so we're doing this as part of a series of Inside Aprendamos. And today I have with me Karah Tooley, who is a speech language pathologist and therapy lead, and Maria Lopez, the Senior Client Support Supervisor of the Esperanza Children's Therapy Team. It is so lovely to see you, and thank you so much for coming on our Zoom chat today.
Thank you for having us today.
Thank you for having us.
So you all have a lot on your plate, and it's a good plate, and it's a beautiful plate, but you do a lot of work in the community, and I've shared with all of your team on how your services have impacted somebody that I care a great deal about. And so if you can, share with us what the Esperanza Children's Therapy Clinic is and why it's so important to have. Because we all know somebody that would be beneficial from your services.
Absolutely. So I can go ahead and start off by sharing the services that we provide. Esperanza Children's Therapy is an outpatient clinic. We provide speech therapy, occupational therapy, and physical therapy for children within the age group of 3 to 18. We have 2 locations. We have one in Las Cruces and one in Anthony. With that being said, we do work closely with our primary care physicians to get these kiddos evaluated through our amazing providers. We do have a handful of bilingual and monolingual providers who are providing services to our children in the community.
That's amazing. And Karah, as a speech language pathologist, I mean, we hear this a lot, and I'm thinking, and please correct me on you're the professional here. And so, we hear, when we see children, there are some that certainly have a little bit of a speech impediment. There's something in terms of how they form their words. How early do you start working with kids when you can determine that there might be some areas that might need some help?
Sure. Like Maria said, we see clients ages 3 to 18. So in some cases, we'll evaluate a child at the age of 2 years, 11 months, or as they're transitioning from Aprendamos early intervention to Esperanza Children's Therapy, we'll evaluate them as early as 2-11, and then we start seeing them at the age of 3 years old. But some clients come to us, later, maybe around 3, 4, 5, sometimes 16. So anywhere from that age range.
And so with that, I mean, I guess 2 years and 11 months, that's really when they're starting to articulate and form words, right? And that's where you can kind of tell if there might need to be help.
Yeah, and we'll do an in-depth evaluation, informal and formal evaluation to see, where they're at compared to same-aged peers and if they could benefit from therapy at their age.
Well, and I wonder, this is for you, Karah, is like, why is this so important for kids to be able to get that really solid foundation of not only being able to hear the words correctly, but be able to speak the words correctly so that they can communicate?
Sure, and communication is the platform of life. We communicate in many different ways, and we want to provide our clients the ability to communicate in all environments, at school, at home, with their peers. And so the earlier the intervention, the better, because we're able to start targeting those maybe sounds for articulation, or if they're having a hard time formulating sentences, we can provide that support so that they're able to communicate more effectively, because everyone wants to communicate. Our little kids who come to us, they want to communicate. They might just need some support to do so.
Well, and I think we've seen this over the last like 10, 15 years where a lot of new parents are using sign language, American Sign Language, because that's another avenue, especially for individuals who might be on the spectrum and are nonverbal. That makes it a lot easier for them to say, I want to eat, and so it's absolutely, that supports what you're saying right there in terms of the need for that. With Maria, with this, there are agencies that you partner with. I mean, not only do you work in-house with all of the different programs that Aprendamos provides, are there other agencies outside of Aprendamos that you get to work with?
We actually do. We work closely with the primary care physician. So we do, we do stay in contact with the primary care physician Ms. Carrie, do you want to elaborate more on the dentists that you all visit? And
yeah, we work with, like Maria said, the primary care physician, that being their pediatrician. And then also we get referrals from dentist, orthodontist. Really, we can accept a referral from anyone. However, we do need a referral from their primary care physician for us to start seeing them. So we are always accepting. We obviously, partner with Aprendamos. That is our main company. And, we'll transition them to Esperanza Children's there.
I'm curious, when you say dentist and orthodontist, what factors are there to where a dentist or orthodontist would be making those recommendations for speech pathology work?
Yeah, for speech pathology. So some referrals that we're seeing from our dentists and orthodontists can include, picky eaters and problem feeders. We might also see some tongue thrust clients. If the swallow pattern is moving their dentition, then we would get a referral. Or also the dentition can impact their speech sounds. So if we have something along the lines of a lisp due to the malocclusion of the mouth, then they would refer to speech pathology or speech language pathology.
Okay, that makes sense. I kind of figured that there was a connection, but that totally makes sense, because especially, a lot of folks, if they have like a crowded mouth, then it really impacts the way the tongue moves, right? And that's pretty much what you're saying.
Right, yeah.
That's fascinating. What other
I know,
thing?
I love it.
Yeah, I think of like audio and certainly our mouth are the two kind of main contributors to how we form our words. Is that right?
Yeah, and also you have to think about, expressive language, receptive language. So it's also how you take in information, and then you organize that information, and then you output the information for others to hear. Communication is such a complex thing that the human body does, and it's amazing.
Yeah, I'm sure you're constantly going, wow, that's a new one.
Yeah.
Yeah. And so, as we finish up today, because I know it's like there's so many things to understand, and that's why it's so great that we have professionals like you who can look at all the different factors that contribute to that one issue, which is why I'm just still so stunned about all the services that Aprendamos does, because it's really like this wheel of a bicycle, and we're looking at one issue is like making sure our children thrive. And then there are all these different factors that you all address. And so it's like, it's absolutely glorious that you're doing that. And so I'm grateful. And so as we finish up today, we talk about the specialized services and speech and language therapy, and then there's occupational therapy, and then physical therapy. Like, what are some of those examples of those types of therapy, and like how they impact young people?
Absolutely. So I know we've spoken a lot about speech therapy, and that's my specialty, so I love to speak about it. But some of the things with speech therapy that we might see is articulation, the way that they form their sounds, or if they're substituting sounds. Language therapy is that receptive, expressive communication piece, what they understand, if they can comprehend sentences and information, and then produce grammatically correct sentences, answer questions, follow directions. So those are all very imperative in a child's everyday life, at school, at home, in the parking lot. Those are all things that they need to be able to communicate effectively. And then when we look at occupational therapy, which is the fine motor, that can include things like using scissors and handwriting, and being able to sit and attend to tasks, which is also, again, important in everyday life. And then physical therapy is more of the gross motor component, where we're talking about running, jumping, walking, balancing, just having trunk control, which is also, again, all of this is very important in a child's life, and it goes into every single thing that they do in their little lives, day to day.
Well, and I think because I talked with one of your colleagues about the program that helps kids who have been diagnosed with autism, and so it seems like a lot of the things that you're talking about are really directed for those kids. Is that the case, or is it more than just kids who have autism?
Yeah, more than kids that just have autism. I mean, we definitely see clients with autism. We see clients with, cerebral palsy. Maybe they had a traumatic brain injury. Possibly they just have a phonological delay or disorder, or a language delay or disorder. They might be a kiddo who struggles a little bit in school and needs a little bit of support with their speech and language.
Whew, that's a lot.
Yes,
I'm
ma'am.
amazed. Yeah, I'm amazed that you're able to keep track of that. And so, and Maria, you don't just serve Doña Ana County, you also serve Luna County, and Otero County. And so, I'm sorry, Sierra County and Luna County, along with Doña Ana. And so, how do you coordinate all of that, all of these amazing services with also these different communities?
So absolutely, we do, like I mentioned earlier, we do have 2 locations, and we like to keep it centralized, what's gonna benefit the family. Because we do have families or kiddos that do come for only one discipline, or we have kiddos who come for 2 disciplines who are making the drive from Santa Teresa, from Salem Park or Chaparral, and we try to coordinate so that they can, make one trip. But also we have the beauty of also offering telehealth services for those kiddos who would benefit from telehealth. I have the expert here with me, and I know that, sometimes some kiddos would be a good fit for telehealth, and sometimes those barriers are there. But we try to work closely with the family. Some families that we do that, for example, live within the La Mesa Mezquite area, they decide just to go to Las Cruces because they already have their childcare in Las Cruces, so it's easier for that drive, and vice versa for Anthony. So it's just, we really just try to coordinate with the family and give them those options, and let them know what is going to be best for them.
Well, I have to tell you, I've been just so overjoyed learning about all the services that Aprendamos provides, and so grateful to get to know you and to know how much you're impacting everybody. And so thank you so much for all of that. And if you're a member of the Las Cruces Green Chamber of Commerce and you'd like to do a Zoom chat, certainly private message me here on this platform. I'm more than happy to provide that information for you, and we can set up a schedule. If you'd like information about the services at Aprendamos, especially with when we talk about the Esperanza Children's Therapy Team and all the different services that they provide, you can get their contact information either above or below, all depending on the platform that you're watching. And also, if you'd like more information about the number of services that Aprendamos applies and provides in this community, that information is also above or below. Karah and Maria, thank you so much. I think on behalf of my kid that I talked to you about, I am so grateful, and thank you for really being so dedicated to helping our young people thrive, and our communities and our families thrive by providing all those resources. So I'm really grateful for that, and thank you so much.
Thank you.
Awesome. Thank you for having us.
All right, you have a great day.